Hello everyone, welcome to Talking Out with Dr. Laz, your favorite health program on television, reaching you from your channel of choice, AIT, from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yesterday, October 25, 2021, Nigeria, Africa, and of course, numerous persons around the world rolled out drums to celebrate media magnate High Chief Raymond Dokpesi. Of course, High Chief Dokpesi means so many things to so many persons, but for us in the health sector, he's done a whole lot in providing platform for health advocacy, increasing health literacy, influencing health-seeking behaviors, and of course, pushing advocacy for strengthening our healthcare system. Of course, without the Africa Independent Television providing platform for this program, we wouldn't have been able to do over 50 episodes where we are able to educate Nigerians and millions of persons around Africa and the world on topical health issues affecting our country. You also know that Africa Independent Television is the only TV station that makes its platform available, at least only national TV station, for patients that are having serious illnesses, needing huge sums of money to treat themselves, to come and solicit for funds for the general public. We join everybody, the management and staff of Talk Health 3 Media Limited, as well as Dark Communications PLC, to celebrate this man on this day. Happy birthday, High Chief Raymond Alioro Dokpesi. So coming to the focus of our program today, the Anambra elections is just days away, especially on 6 November 2021. A whole lot of aspects have been discussed on various media channels and different perspectives. Today, we are going to be looking at the health sector. What is the state of the health sector in Anambra State? What should the candidates focus on, and what should the next governor of Anambra State focus on? One might be wondering, why are we talking about this? Is it not politics? Yes, it's politics, and health is politics. Health is politics because the decisions that are made to determine how much government spends on health is made by politicians and elected officials. The implementation of the health agenda in the interest of the persons is also a political decision, and also ensuring that the resources for health is utilized judiciously, efficiently, to impact positively on the people is made mostly by political actors. So we can't always be discussing health in isolation, because health is a political issue, a security issue, an economic issue, and everything. So on the program today, I have two fantastic guests. One is a health professional, and the other is an active citizen from Anambra State, who is going to be joining us virtually, to share his insights on the state of the health sector and what he wants to see the next administration do in the state. So that's what our discussion is going to focus today. You are going to see our guests shortly after this break. Do follow us on our social media handles, and also feel free to go to our YouTube channel, Talk Health Nigeria TV, to watch previous episodes of the show. And of course, this show will also going to be available. We'll be right back after this break. Do stay with us. Welcome back to Talk Health, Dr. Laz, your favorite health program on television. Yes, we are talking about Anambra 2021 and the health sector in focus. A couple of months ago, I went to Anambra State, and I made a tour to get on ground on the situation of health in the state. I moved around from Oka to Nnewi, to Nteje, and also a number of other communities within the state. What I found interesting was there is significant presence of the private sector in the health system in Anambra State. A lot of private hospitals and a lot of private individuals who are contributing towards the upliftment of health in the state. I found it amazing that at the Nnamdi Azikiwe University Teaching Hospital in Newi, that the certain individuals convened by Senator Ifeanyi Ubah, they call themselves Anambra Progressives, came together, contributed money to donate a building to the teaching hospital. And that building is currently used as a clinic with a lot of rooms. Patients were there, very fine facility, and they published the names of all the donors, more than 300 of them, including some persons who are not even from Anambra State. And of course, the same group of persons made a similar donation at the Nnamdi Azikiwe University in Awka, and is being used as the students' clinic. So that's to the extent of participation of individuals and, of course, persons, the private, in influencing health in the states. And it's quite commendable because health is everybody's business. I moved around the city of Awka looking at the environment and the environmental sanitation, and it wasn't quite pleasant to see heaps of refuse in a lot of places around the city. So waste management was really poor. And there's a lot of relationship between the environment and our health. So that's really a poor public health practice. At the Chukwuemeka Odumegwu Ojukwu Teaching Hospital, I also made certain findings on the state of the hospital. But one good news that got me excited was the state of the health insurance coverage in Anambra State. Comparatively, the health insurance agency was set up a couple of years ago, and using the adoption method, they've been able to get many persons. If you have enough money, you can pay for persons to get enrolled in the health insurance scheme. So I had the executive secretary once on this program, and he spoke very well about what they've been able to do, and I actually found out that they're among the best performing health insurance agencies in the country. So that's the extent of a number of things that's going fine. So on the program, I will not do all the talking. I'll bring in my guest. I'll bring in my guests, and let's begin to discuss these issues. In the studio, Dr. Henry Ewunonu, you're welcome to the program.
Grateful to be here. Good evening, viewers.
Yes, Dr. Henry Ewunonu is a pathologist and also a health systems advocate. He's a member of the Health Sector Reform Coalition. So, Dr. Ewunonu, at the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, is a tertiary health facility in the state training medical doctors and also resident doctors. One of the key things I found is dearth of human resource. So you don't have sufficient number of consultants, you don't have sufficient number of residents and even house officers. And it's because they are not being paid adequately. That's one of the reasons that some of the health workers told me about, that they are getting 70% COMMES. COMMES is the Consolidated Medical Salary Scale, But a couple of days ago, I was informed that the state government had approved 100% COMMES for them, which they might start getting by the end of this month. A government official said that, so I've not independently validated that claim. So how would you comment? Anambra is the light of the nation, so, and one would expect that with the human resource strength of the state, there should be an example in terms of the teaching hospital. How generally, what is the normal thing that is supposed to be in a state university teaching hospital like the Chukwuemeka Odumegwu Ojukwu?
Thank you once again for having me. If you permit me, I will also join you to congratulate the media mogul of the world, not just Africa, on his 70th. He is one exemplary Nigerian, one that believes in the Nigerian's health system. He and family were struck last year and they were treated here. He didn't even go out later to recheck himself or have second opinion. And the most important aspect of it, he came back for Thanksgiving. May the good Lord bless you
Amen.
Now, to your question, the issue of healthcare delivery is so complex, yet simple. What do I mean? Complex in the sense that there are multiple variables. You need multidimensional intervention. What are the requirements for a state teaching hospital? I feel bad when people say, but that's just a health center. That an institution, a facility is a health center, does not reduce the humanity of the people that patronize it. There should be standard treatment guidelines similar anywhere. Let it just be the location that will make the difference. Simply put, the Medical and Dental Council of Nigeria is statutorily given that responsibility to regulate medical education and training in Nigeria. So they have a checklist or standard requirement for approval of an institution as a center of training for medical students or for residency. That of residency is in addition oversighted by the Postgraduate Medical College of Nigeria or the West African Postgraduate Medical Colleges. Now, but simply put, because there are up to 26 departments.
Okay, that should be in a teaching hospital.
Yes, that should be in a teaching hospital. Purely clinical and non-clinical. That medical school admits at least 50 medical students per class. It now means that at least you need 4 or 5 consultants in these separate departments. Because that center will also be used for training house officers
and residents.
Yes, there should be 4 house officers to 1 consultant.
Okay.
So that will now bring home. I think, given what we hear about that university teaching hospital, it is acutely short-staffed.
Yes, it's actually acutely short-staffed because you mentioned radiology. At the radiology department, you have no full consultants at the moment. The one the hospital had left, you know, and what you have is part-time, you know, 1 SR, senior registrar, you know. Then they have CT scan, digital X-ray, no MRI, medical image, and ultrasound scan as well. So, but that hospital is located at the expressway. So with no full-time consultant and you know, a visiting SR, what happens when someone has severe head trauma, perhaps along the Oka-Onitsha expressway? Then plastic surgeons, they have 2 retired ones on contract. And anesthesiology, no full anesthetist. Nobody on full employment for anesthesia. But you know, having the services of a retired consultant and one that is part-time. You know, so these are some of the nuclear medicine. There is no oncology. There's no oncology in it. There's no cardiothoracic surgeon. You know, so some of the critical areas, especially in emergency medicine, being a hospital located in a city that you have a major federal highway, at least one would expect that cardiothoracic surgeon, neurosurgeon, anesthetists, and all of them, you know, radiologists will have a good number of them because these are persons who make critical decisions in situations of emergency. So election is coming up. So the essence of this program is not to appraise those who are going out, but to bring this to force so that we make certain recommendations to those who might, who are seeking to replace the incumbent administration. So what would you recommend in this regard as related to this acute human resource shortage in that hospital?
In your intro, you cited the Alliance for Anambra State, the Light of the Nation. And that comes from, I think, another state Anambra compares with is Ekiti State. In having number of intellectuals, highly trained professionals. I don't think there is any tertiary hospital in this country you will not find up to 5 consultants from Anambra State. And so many other states in the southeast. In my own intro, I said it is complex yet simple. Number one, health has never been prioritized in this country. It has never been put at the front burner of our politics. The state of healthcare delivery, the indices being measured, to assess health, they have never been part of decision making in choosing between Mr. A or Mrs. B as who to appoint or who to elect.
So what do we need to do to make it a
Yeah,
major
so
issue in
this
election?
is becoming, in short, it's even belated. But thank you for bringing it up. And I challenge Anambrarians who are listening this evening. Though certain circumstances have made campaigns not to be as robust as possible, I still want you to engage these your candidates. Ask them about their health programs. What do they want to do? How do they want to do it? Very, very important.
Thank you very much, Dr. Unono. Let's take a short break, and when we return, I'll be going via Zoom to hear from Uche Okoye. Yes, that's Uche P. Okoye there. He's an active citizen in Anambra State, and also the convener of TETA. TETA means wake up. Uche, just a second, let's take a break and I'll come to you. Do stay with us, we'll be right back. Welcome back to Talk Health Dr. Laz, your favorite health program on television. Yes, join me via Zoom is Mr. Uche Okoye, who is I describe him as an active citizen, but he's very active in promoting good governance, promoting health, and a lot of developmental issues in Anambra. You're welcome to the program, Uche.
Thank you so much for having me. Am I audible enough?
All right, great.
Yes,
so with me in the studio is Dr. Henry Unono. We've been discussing the state of the health sector in Anambra State. And coming to you now as someone has been following, you are resident in Anambra, you've been following the campaigns, you make use of the health facilities. So how would you assess the state of the health sector in the states? Let's start from there.
Okay, thank you so much. I would have to be very honest. One of the areas that I find very quite lacking in Anambra State must have to be the health sector. That is quite, interesting because in Anambra, we have all forms of qualifications. We have all forms of people, people from different background, the health, the doctors, people who are very rich enough to finance and own some of these facilities that's supposed to give us what we need as a people. I find it quite lacking from governments that they have not really focused in health financing, or they have not paid close attention to health and other things therein. If you look at Anambra State, for example, look around the type of health that is owned by the government. They are mostly underfunded. The structure is nothing to write home about. It's not something obtainable. It's not world class. It's not something that you can regard it as world class or even national class to start with. So it's something that I think the previous governments in Anambra State have really neglected. And it is sad. It is really sad because it is an area where the private sector or the private individuals have taken upon themselves. If you look at Anambra, for example, the best hospitals we will find here are mostly, private sector driven. And so the government owned and those funded by the government are not really up and doing. They are not doing well. Their workers are not well paid. So I will rate the health sector in Anambra State very poorly in my book. That's what I have to say.
All right, thank you, Uche, for recognizing the role of the private sector. Let me state that there's absolutely nothing wrong with active participation of private sector in healthcare. But what's important is, in fact, there is actually more need for more investment of private sector in healthcare. So, but the government has to create that environment and also, very importantly, monitor the quality of care they are providing to the citizenry, not just that they are collecting a lot of money and they are mismanaging patients. So what would you want to see, what agenda would you want to set for the next governor of Anambra State as the election comes up on November 6th? So as a citizen who's been promoting good governance, what are those things you want to see in the health sector?
All right. Number one is, for example, the state's-owned hospital we have here in Amako, very close by. The government needs to uplift that hospital because it is really sad to see Anambra State. It attains such a very poorly built infrastructure. It is not something that's befitting to a state like Anambra State. We deserve something better. I've been in the hospital, and I can tell you that I'm not very proud to identify with that. So I reckon that the next governor that we're going to be, comes November 6th, after November 6th, should look into that. Again, we have other areas, not just the teaching hospital in Anambra State. We have general hospitals across local governments. They all should be rehabilitated. We need modern facilities in these hospitals. And more importantly, the workers are underpaid. The Anambra State happens to be one of the least paid medical practitioners in the country. And it is sad to hear. I have a couple of friends who are medical, who work in medical line, and I listen to how they complain and cry about their negligence from the government. So I expect that the incoming governor should focus on this. Payment of salaries to these health workers is not too much to ask. It's something that they deserve. And we've been losing a lot of talents to other states. We're losing a lot of talents to other countries as well as a country as it is.
Right.
So we have a very dire situation because the very few ones we have left behind, they are looking for a way to escape as well. So I'm encouraging whoever that gets into power after November 6th should take it very seriously. Health, they said, is wealth. And we have a lot of quackeries around. As soon as you enter Anambra State, as soon as you get to Head Bridge, you start hearing a lot of medicine, trado and all whatnot. Okay. And I feel, apart from environmental issue, the discomfort they cause in the environment, I think the government should step up and ensure that they put an end to some of these things, because some of them are quack, some of them are not certified by NAFDAC, and they sell all forms of concussion to people. So I encourage the government to look into this, because it's something that has been brazenly abused by the people who are practicing it. They call it herbal medicine. It is also part of it, right? So they should also look into this and ensure they sanitize our sector so that our citizens will receive adequate and very proper health care. So that's what I reckon for anyone that comes on board after November 6th.
Okay, thank you very much, Mr. Okoye, for those thoughts. Let me come back to the studio briefly. Dr. Unonu, you've heard a number of things he said. Yes. How do you respond to that?
I am most grateful to him. He's an active participant, and he has been observing the sector very quickly as a system, using systems approach. Let's look at infrastructure. Anambra State has commissioned an airport. Nothing substandard is there. The navigation equipment, nothing substandard. Right. They will not be, miserly with provisioning of any of the equipment needed. So why should we use substandard, inadequate equipment in the sector or building? Human resources for health, manpower. There is internal brain drain because it is leaking. Brain is leaking from where the people need it. Rural areas, public general hospitals, to where the pay is higher, to where people may actually be redundant. Why? Attract, retain. How do you do that? Pay. Drug and vaccines. Anambra comes first when it comes to local manufacturing in this country. The woman who is pioneering drug manufacturing in this country, Emzo, is from Anambra State. So they can be excelling in one bit excellence, and the other one, all the malpractices around Bridget, all the manufacturing, malpractices around Mix Eremogwu still thrives. Healthcare financing, look at, Dangote has said, please get companies, quoted companies, to spend at least 1% of their profit before tax on healthcare delivery. If Anambra government becomes innovative and creative in mobilizing resources for health sector, they will come second to none.
It's been a long conversation. One will feel like continuing.
So many issues.
Yes, there are a lot of issues, and of course, just one show would not be enough. But we've started the conversation. This is important because the election is all about good governance, and without health, we have nothing. I know you might be looking forward to a much longer conversation, but our time is really up. What's one major recommendation you have for citizens themselves?
All right, I want to use this opportunity to tell everyone in Anambra to come out and vote on the November 6th. Come and vote the candidate of their choice. That's number one. Then number two, I encourage every citizen to take their health seriously. Thank you for having me.
And thank you, Dr. Ewunono, our super health advocate, Nigerian Medical Association chieftain, and so many things in one. It's a thanks for being a part of this.
Thank you for having me.
All right, to you, our viewers, thank you. And to everyone in Anambra, play your part to make our hospital work, and demand to know from your candidates, your governorship candidates, what do they want to do in the health sector. Well, our next show, we hopefully would like to have some of the governorship candidates on this show to share what they want to do for the Anambra. So if you're interested in that, look at our contact details on the screen and get across to us. Same station, same time next week. Let's make our hospital work. My name is Dr. Lars Eze. Bye for now.